The awareness of harsh working conditions in state hospitals began when a famous doctor and online influencer known as Dr. Pui Mek posted that she had decided to quit her job at a state hospital. She explained that the state hospital has been experiencing staff shortages and that there are fewer and fewer doctors. Nonetheless, the hospital has no plans to hire more doctors, resulting in other doctors having to work like slaves, which is affecting her health, both physical and mental. This public awareness has forced the Public Health Ministry to acknowledge the situation. The Deputy Permanent Secretary for Public Health, Dr. Tawisin Wisnuyotin, revealed that state hospitals in Thailand are being hard hit by a shortage of medical professionals. Current staff are overworked, forcing doctors in at least 9 hospitals to work more than 64 hours a week, which is much higher than the standard 40 hours. Citing information from the Medical Council of Thailand, there are about 60,000 doctors working in Thailand. Of these, almost half work in state hospitals and are responsible for the 45 million Thais covered by the universal healthcare system. If we put this in a ratio, one doctor in Thailand is responsible for 2,000 people. He said that the Ministry of Public Health has been trying to reduce the workload of doctors and other medical staff, but without much success due to the shortage of manpower, especially during the COVID-19 pandemic. In the past 3 years, over 450 doctors have resigned from state hospitals, many of them moving to work in private hospitals, which are less taxing and offer better compensation. At the same time, another 200 doctors have retired. Poor housing facilities for doctors working in the provinces have been cited as another reason for young doctors leaving the system after having worked there for just a few years to fulfill their commitments. In an attempt to address this shortage of medical personnel, Dr. Tawisin said that the Ministry of Science, Research and Innovations has set a target for Thai universities to produce 3,000 new doctors each year until 2027, plus an additional 10,000 doctors to be produced by the Ministry of Public Health. However, he said it is estimated that only about 2,700 doctors can be produced each year, as some will not graduate as scheduled. Dr. Tawisin further explained that each medical student has to study for 6 years, plus serving 1 year as an intern, adding, however, that the Medical Council recently required another year for the young doctors to gain more experience. Since the interns are required to teach medical students in addition to their work in state hospitals, he said they're facing work overload. Recently, the Medical Council of Thailand set up 2 working groups, one to solve the shortage of intern doctors and another to set the guidelines and rules for intern doctors. Though the council itself clearly stated that doctors should work no more than 40 hours per week, they admitted that some hospitals cannot adhere to this. Meanwhile, Move Forward Party MP-elect Wayo Asawarungrung suggested a few ways to prevent more medical personnel from resigning. Although Wayo is currently an MP and was widely known for his entertainment career, he has a medical degree from Mahidol University. One of the suggestions is to reduce the working hours where doctors do not work more than 80 hours per week in the worst case, and nurses should not work more than 60 hours per week. Doctors should also get at least 8 hours of rest if they have been working continuously for 24 hours or have worked the night shift. The salaries of medical personnel should also be revised, as many of them complain that their salaries have not been increased for 4 years and that they should be in line with the responsibilities they have.